name is Farah Schwartz, and I'm Manager of Patient and Family Education at Toronto Rehab University Health Network. And the way that patient education and patient and family education is connected to engagement is that patient education is a critical form of engagement. So patient education can be looked at as helping people learn about their healthcare, helping them self-manage, providing them with information that they need. And really, in order to engage, they need to have education, they need to understand about their healthcare, the healthcare system. One of the things we talk a lot about is health literacy. So the skills that people need to really navigate a healthcare system, to find and use health information, and to be engaged, people need to be able to have those skills. Otherwise, they can't really engage meaningfully in the system or with their providers. So patient and family education and what I do and work on, I feel is truly critical to patient engagement.
And that's great. And just to follow up, so what do you think are really the three main challenges in patient experience in terms of moving it forward from where we are today?
So I think some of the key messages from the from the panel this morning when they talked about what they were doing with the Patient Advisory Council. So one of the key things was really you have to be ready, and you have to be ready and able to engage people. If you bring people to the table and then you don't do what you're saying you're going to do, that's actually, it's harm. And there was a webinar that I saw that they talked about. Essentially, a harmful thing is to engage people in that process and not act on it. But on the flip side, it really takes a lot of energy and it takes a lot of resource to truly engage people. So whether it's having at least one dedicated person or being able to help empower people so that they can participate in a way and to help create that culture change, it takes time and it takes effort, and a lot of organizations just aren't in a place to invest in it, or they don't have the resources to invest in it. So I think across the country, a lot of people don't necessarily share the vision, and that in and of itself is a barrier. But then even those who do don't necessarily, they're not in a place to truly enact it in a way that maybe in more consumer-driven systems or more already patient-centered systems are.
Right, so in that sense, where do you think that Toronto Rehab is in terms of their implementation for a patient experience model?
So Toronto Rehab integrated with the University Health Network 2 years ago, and so there are some definite similarities and then some things that are different. So I'll speak for Toronto Rehab, not about UHM as an organization overall. Toronto Rehab is a very engaging organization from a clinical perspective. One of the things that's different about rehab, there's been a lot of talk today about acute care. Rehab is different because even though, of course, you want consent and you want people to be engaged in their care and their management, more and more people need to be because they're dealing with chronic conditions. You could do acute care to someone. You can treat somebody and they're not necessarily engaged in their care. But you can't engage in rehab with someone if they're not engaged in it. You can't make someone do therapy. You can't make someone do exercise. And so engagement is critical from a clinical perspective. I think because of the overall commitment to that and understanding of that Toronto Rehab as an organization really acts out a lot of patient-centered ideals. So some of the things we're talking about, follow-up phone calls after discharge and just ongoing focus groups, things like that are in place at Toronto Rehab. And as well, each clinical program has a community advisory group or a patient and family council that advises and includes members of the community as well to talk about the continuum of care and engagement. So any organization, I think, can continue to improve, but Toronto Rehab really does live a lot of the philosophies that are being talked about today.
That's great to hear. And then lastly, what were you hoping to get out of the conference?
The networking and meeting other people who are doing this work. I think it's great to get that, and I'm also really excited to hear examples from across Canada because there's such a diversity in how things are playing out from coast to coast. So hearing about that has been a really neat experience.
Perfect.